All right. Well, thank you for being here with me today. We're very excited to have another GI psychologist on the podcast because this has become such a hot topic, but often misunderstood topic. So I'm really glad that we're going to be chatting, and I'll give you a minute to introduce yourself to our community.
Sure. My name's Navidi. I'm a clinical psychologist. I've um, I've specialized in GI. I was looking the other day, and maybe it's over 15 years at this point. And but I'm community based, so that's what kind of sets me apart from a lot of the GI psychologists out there. I started off in a private practice in the community in the DC metro area, and then about 5 years ago, I was kind of lamenting the lack of other providers out there, because once I'm full, in the DC metro area, there should be a lot of other therapists, and there are, but none of them could, do this work and were outpatient, you know. A lot of them were a lot of the other GI psych folks were associated with university medical centers and things like that. And so I was like, this is crazy. We've got millions of people and that need this help and very few people trained to do it. So that's why we started GI psychology, myself and another psychologist. Um, we've worked really, really hard to like build up capacity and I could kind of go off on that, um, but it's been a really great adventure. And now we can provide these specialized services to patients all over the country.
Yeah, that's wonderful, especially for so many of us that are in rural areas like myself who aren't close to big cities where you may or may not have somebody. So I know because you guys do telehealth that that's such a great accessible way of reaching patients. I know insurance can always be a barrier, but that's not on your end, that's on the insurance and a whole other conversation. So with GI psychology in itself and what that means for somebody who has no clue what we're talking about, can you share, like in layman's terms, what it is that you do and what makes GI psychology so different from a chronic illness patient just going to see a psychologist?
Right. So as an example, like you go out to the community, and you're a GI patient, and first off, they just don't know. They just don't know. Like, for example, a lot of them don't know the difference between IBS and IBD,
Hmm.
much less know what gastroparesis is and what that means and the implication. First off, there's that level of knowledge, right, that a GI psychologist needs to have. But then there's a lot of specialized techniques for helping patients. So it's not just about having someone to talk to, which is
Hmm.
good and useful and needed. But also, if there's chronic pain, there's techniques for treating that, like
Hmm.
actually reducing the pain. If there's chronic nausea or bloating, like there's actually empirically based treatments that work for those kinds of problems. And that's not what you're going to get from your community mental health provider. And they're very well trained in what they're trained in, and they're caring and they're good, but they don't know what to do with like nausea and vomiting
Yeah,
other than help you to feel not as maybe not as emotionally bad about it, which is,
sure.
useful, but I'd rather like stop vomiting, you know?
Yeah. Yeah. I know my therapist is always very empathetic, but I don't think that she has the full knowledge that someone like yourself would have to say, well, if you're starting to feel nauseous or you're feeling like you're vomiting or you're bloating, she might give me generalized advice, which is great, but it's not quite what you're looking for, and that's really great of what sets you guys apart. Um Now, for somebody who is like me, when I first heard about this, I'm like, hold on, wait a minute. I need to get in to see somebody. How do
Yeah.
I do this? So, how should patients advocate for themselves in their doctor's offices? This isn't something that is brought up very often in a lot of medical settings with providers, which I know is something that we've talked about in the past and has been a bit of an obstacle for patients to get this type of care. So, where would a patient start in trying to have that conversation, or where would you suggest that they start?
Well, there's kind of two roads. Like, they don't need a referral. They don't have to have a referral. Um, we're out of network unless they have something like Kaiser
Okay.
insurance. Kaiser's really locks down their patients.
Hmm.
Um, but if they've got private insurance, um, there's a lot of options for them. And they just go to our website, gipsychology.com. They get a free phone consultation. The person on the phone will explain the treatment, how that might fit for their symptoms, the financial aspects of dealing with the insurance companies. Because there's actually, so since we're out of network, people pay the full fee, but there's two major options for them to get a lot of that money back. One is just reimbursing for out of network care, which I'm sure, Sam, you're familiar with, right?
Yeah.
Um, and different insurance will reimburse at different rates.
Hmm.
But there's also something called a gap exception.
Okay.
And if you have not heard about this, let me tell you, the gap exception is the thing with us because what you're doing is, and we help our patients with this.
Of
You're
course.
going to the insurance company, you're saying, "Hey, insurance company, do you have a gut brain therapist for me in network for me to see right now?"
Hmm.
And guess what the answer is usually, or almost
Probably
always?
no.
No, we do not. No, we do not.
What is
And
that?
what is yeah, even what is that? And so, but because they don't have that, then they will provide what's called a gap exception, meaning they will allow our services to be reimbursed as in-network care.
Okay, good to know. Very
So
good to know.
now they're getting like 80% of of the fee back.
Mhm.
80, 90, sometimes 100% of the fee back
Wow.
once this gap exception has been granted.
Wow.
Um,
Very
so it's
good
a
to know.
really big deal in terms of costs.
Yeah. Now, if we get that out of the way, right? Like you get in with somebody, they make the phone calls, they do all of the things that they need to do and get set up with somebody on the team. I know for myself that I always want my other physicians to know, what physician A is doing with me to what physician B is doing. So you want that like continuous care and you want people to be in contact. That's a beautiful scenario that doesn't always happen, but let's say if for the sake of my hypothetical, how would your, team or any of the clinicians, psychologists that you have on staff, like, connect with my specialist, because you are in separate networks? Like, how does that work so you can kind of talk to each other? Your, motility, your GI doctor knows what's happening over here, here knows what's happening over there, and really try to get the best care for, like, me as the patient. What would that look like, or what does that look like?
I think the good news is I think that we train our clinicians to be really annoying and to be pests, essentially. Because what we want to do with every patient is at least check in a couple times.
Mhm,
So we want to know, okay, who's the primary person? Is it your gastroenterologist? Is it your PT? If they're coming for like chronic pain,
mhm,
like who's the person we need to connect with? And we want to connect at least once and then twice, when treatment's over. Um,
mhm,
and I'll give you an example. Do you know Dr. Asma Capra?
mm-mm,
She's a female gastroenterologist, great clinician, does a lot of work around, around the country. But so I'm sharing a patient with her and, um, like, I'm like, how much of this is structural issues? How much of this is like brain gut issues that I can help with? So I'm reaching out to, like, I've known her for a while. So I'm reaching out
mhm,
by email. Sometimes I'll give her a call And we're coordinating all this with the patient. The patient knows that we're talking. She just had an appointment with her, and now I know that they're going to work on their constipation. And
Mhm.
I'm like, okay, how can I help? Ideally, that's how it should be working.
Yeah.
We want to develop relationships with these other providers. That's the
Mhm.
perfect scenario, right?
Yeah.
Sometimes we have to be a bit of a pest because there are some physicians out there, I won't name any names, that just want to like do their thing and not really have
Mhm.
to talk to too many other people,
Yeah. Yep.
which
I
I
get it,
understand.
though. I get it.
Yeah, I get it too. I get it. People are busy.
Mhm.
But that's why we have to be a bit of a pest.
Yeah.
So we'll call the office, we'll try to get their email, we'll leave voicemails and stuff like that. Just because that communication is so important.
Yeah, you guys sound like what we do as patients, trying to get a hold of people, being the squeaky wheel all the time.
Yeah.
It's it can really be fruitful, to be that person, but I know even for myself, like, there's a way that I have to toe the line a little bit before, like, I've driven somebody so nuts that they're like, "I just don't wanna deal with you anymore." So, it's a fine line of, how much can I annoy somebody before they're like, "Please just leave me alone." But
Before they
thankfully
fire you as a patient.
thankfully, that doesn't happen very often, at least for me. But it's great to know, like, I think coming from my perspective and like what I've seen as a patient, what I've been through as a patient, to really not just be like, wow, I didn't know this thing existed. Like, I'm still mind boggled at that just from my work at G-PACT over the last however many years and, working with motility specialists. I'm like, why did nobody ever bring this up to me? And I will never not say that because I know in our support groups we've talked about GI psychologists and we've got some people that are like, yeah, I have one. And then we have other people that are like, what the hell are you talking about? So
Right,
that's something on our end as an organization where we're like, this is something that could potentially help other people, but how do we get that out there? And there's
right.
so much misinformation around it too. And I know that you and I have talked about this in the past of, you mention any sort of mental health treatment in this space. And depending on how it's approached to the patient, it
Yeah,
can make it sound like something the complete opposite of what it is. It's a tool to help you. It's another piece of the puzzle. It's another something to help get you going. It's another supportive arm in your care. And it's very difficult to get that information out there when there's been so much other misinformation. Some of that even can come from providers. So, I know GI psychology as a whole has really done a lot of education in connecting with providers and and other clinicians to say, hey, we're here. This is what we do. Like, it's this really cool thing. Like, would you like to learn from us? So I know that there's been so much work on your end, and we're starting to see that now because we've had a lot of conversations. There's a lot more conversations happening. So the work is slow, but it's paying off.
Sam, on my end, I was kind of, gobsmacked myself learning more about gastroparesis because over the years I've had a good number of patients with gastroparesis, but in a way, I always just treated them like they just had another they had another disorder of gut brain interaction, and they would respond well. Uh, but when I got connected with you all, I started, digging deeper into the research, and I was like, "Good lord, nobody has helped these people. Like, nobody has done the research to show that So, to back up for someone listening, the treatments we use, cognitive behavioral therapy, like specific kinds of it, and then clinical hypnosis, specific kinds of it have been well studied. Like over 40 years, we've done
Mhm.
studies with IBS and functional dyspepsia and like all these different disorders. But I look for gastroparesis and there's almost nothing. There's almost nothing. And then I look at the research showing that very likely gastroparesis is on a continuum with functional dyspepsia, which makes complete sense to me, in terms of the patients I've seen. And I'm like, okay, they've researched these treatments with functional dyspepsia. They've shown, I mean, they've shown that it works, that it's helpful. Why has nobody gone and done the same thing with gastroparesis patients?
I'd love the answer to that question.
I was like, "What is happening here?" Because
Yeah.
like, our group, we treat the patients. We're not in charge of, like, we're doing some research, but that's not our main goal, right?
Mhm.
And so I that's what just kinda floored me. I was like, "Why is this not happening?" Because
Yeah.
yeah.
And you were at our summit meeting that we've had a couple in the last few months, and and that's one of the things where we're looking at this as an organization, and really, like, when you zoom out a little bit and you look at everything as a whole, it's like, what is happening? You've got some people over here doing some really great things. You've got pharma making some medications,
Yeah.
doing clinical trials. We have what you guys are doing over here with gut brain interaction. And it's like, but everything is so far apart. And
Yeah.
then when you really start to look at the patients in the center of it all, there's things that have happened that patients didn't even know about because it didn't even get far enough to get to a point where you would start involving patients for clinical trials, or
I
it
would
doesn't get
love
approved, or
I would
it's
love
just,
to
it's a
see,
mess.
let's take a clinical trial and just can we just make another arm where we, like, give them the drug and then we also give them, clinical hypnosis?
Yeah.
And let's just, like, keep collecting the data like they already set up for the trial, and
Yeah.
we'll just see what that looks like, right?
Yeah.
Like, I
Yeah.
would love to throw stuff like that in there.
Yeah.
Because think about what that would mean for patients if they're like, "Oh, shoot, this drug works," but then the patients with drugs and clinical hypnosis get even better.
Yeah. Yeah,
Eh,
I know. It's a crazy, crazy thing. And I look at these options and what you guys do and the treatment, and it's like it's not traditionally, medicinal. It's not invasive. It's not hurting. There's not this laundry list of side effects or a black box warning on what you guys do. So to me, just as a person trying to look at this logically, I'm like, why isn't this one of the first lines of defense? Why is it always X, Y, or Z? And for me, looking at that and really, like, the point of what we've done in the last few years, and I say this all the time, I'm a complete broken record, but it's that education and bringing the information to the patient, because a patient might say, you know what, that's not for me, but I'm glad I had the information to make an informed decision. And that's
yeah,
really
they
what
should
it's
have the
about from
choice.
our end. Yeah.
Yeah,
And if you don't know something, if you don't know something exists, you can't even ask for it. I would have asked for something along these lines so long ago when I was sitting in the office crying because I've been on all the medications, I've had surgeries, I was on TPN, I was on tube feeds, I failed other medications, and I'm sitting here like, what do I do now? I feel miserable. You can't tell me that, like, I just need to go home and come back in 6 months or eat less food. Like, I'm already eating less food. What more do you want from me? Nobody said, hey, here's another option. I would have been willing to do all the work to get the option too. Like, you didn't even have to do anything.
and it's so sad to me because, these are skills I feel like anyone with a chronic GI condition should know these things,
Absolutely. Yeah.
because there's no, like, border between, like, let's say, FD, like, functional dyspepsia and gastroparesis that says, "Well, if you've got functional dyspepsia, we can teach you this really cool skill to reduce your nausea.
Hmm.
But once you have gastroparesis, once you have, like, delayed gastric emptying, suddenly that skill isn't gonna work at all."
Mm.
That's not how people work, right?
Yeah.
So it's like, these are skills that you can learn and you can use it the rest of your life. I mean,
Hmm.
I joke that one of the side effects of clinical hypnosis is learning how to reliably calm yourself down.
Yeah.
Like,
Yeah.
who wouldn't want that side effect, right?
Yeah. I know the first time when we had Megan Real on the podcast last year and she was talking about hypnosis, I was like, wait, what? Like, what?
Yeah.
Hypnosis? Like, what is that? And again, I'm coming at this with from a place of completely an open mind. Like, I want to learn, and even I was taken aback, and then I was like, wait, okay, we have to explain this. Like, what does this mean? And then going through some of the motions of like, what does it look like in a average treatment for a patient with GI conditions like
Yeah.
gastroparesis to come in, and like, what could we do for you? And like learning about what hypnosis in a clinical setting actually is, how it applies here. I'm like, sign me up, sign me up. Like, this is what I need. This is what I've been asking for. This is what I've been wanting. And, it sounds kind of funky from the outside, but that's just a lack of education and awareness around it. And that's not on the patient, and it's not on you guys. So, not calling anybody out, but other things in the world have to
I
happen to
know,
get
and
the information out there.
I've been tireless. I mean, just so many podcasts, so many talks,
Mhm.
trying to get people to just even understand the difference between entertainment hypnosis and clinical
Yeah.
hypnosis,
Yeah.
right?
No clucking like a chicken. I know.
Yeah. Swirly whatever thing or a watch, like, um, and it's sad because these are things that all humans can do. It's
Yeah.
almost like our birthright. Like, we just need to learn to use it, right?
Mhm.
And so many people never learn to use their innate capacity for healing
Yeah.
or for symptom relief. So it's like there's so much left on the table that they could improve their quality of life that
Yeah.
they don't even know, because all they know is mind control, magic, and clucking like a chicken. That's it.
Yeah. I feel like everything always comes back to just like calming down my insides, right? Where you think about it as just a person who's been under a lot of stress recently, and, whether it's the just life stress, health stress, whatever it is, just that umbrella stressor. My stomach has been so much worse since I haven't been able to manage my stress. And that's not something that's exclusive to chronic illness patients. That's everybody. Like, that's why you get butterflies in your stomach. That's why sometimes,
Yeah.
like, if you get super nervous, you're running to the bathroom and you end up having a bowel movement. It's not just us, but because of the GI conditions that we have, our side effects, our symptoms to those stressors, whatever they may be, our reactions to that are that much worse and can be detrimental if our body cannot get out of that fight or flight mode. And to some people that sounds like, no, you're saying that that's in my head. Absolutely not. But our brain and our central nervous system, our body, everything is connected together. So they're going to have some sort of relationship. So it's
Right.
not that it's in your head, it's that it's connected and it's a part of it. And if we ignore that part of it, we're ignoring another option of where you actually could get some benefit in treating that or offering it
Yeah.
something, because you're just adding tools to the toolbox. You're not saying, hey, I don't believe that you're actually sick. Nobody's saying that. I mean, I hope nobody's saying that. Nobody's telling you that it's all in your head. They're
I
saying that we
think
want to treat those pieces of it and help you get better.
the problem is, I'm not trying to pick on anyone. Me, everyone, we don't do well with complexity.
Yeah, you're not
We
wrong.
want our answers to be simple. It's either this or it's that. Like, give me
Mhm.
some choices. And when it comes to the body, the reality is complexity,
Yeah,
right? There
yeah.
aren't simple answers like, oh, because you're seeing a GI psychologist, it must mean it's in your head. It means, like you're saying, that we have a head, we have a gut, but we also have a
Mhm.
neck
Mhm.
and we have a nervous system, and it's all connected and it's all talking to each other. And what happens here affects here, and what happens here affects there.
Yep.
And that can be scary because, like, you're going through something and suddenly your symptoms are a lot worse.
Yeah.
But it can also be empowering
Mhm.
because if we learn the levers that we can turn up here, we can influence things down there. And
Yeah.
that's not
Yeah.
just the gut, it's also pain and discomfort and things like that. So,
Yeah.
um, we just have to be able to we have to be able to tolerate the fact that there isn't a clean answer of one or the other,
Yeah. Yeah.
that it's complex and a lot of different things are happening.
Yeah, it's very sorry, my cat had to have some attention in the midst of this conversation. But
Obviously.
it she does this a lot. She tries to be the star of the show. But I think about conversations that I've had with other patients and with myself and even just with my therapist, with my husband, all of these different things, and I'm like, I just wanna feel better. I really I'm tired of feeling like this. I'm tired of feeling just exhausted all the time. I'm tired of going to my doctor's office and saying like, "Hi, how are you today?" I'm like, "I'm going to spill my guts all over you and tell you all of these things." And then you just get like, "Okay, well, we'll see you back in like 3 to 4 months or maybe a year depending on their schedule." And it's like there's so much that's missing in our regular clinical care. And I feel like these are the things that could really fill those gaps and give us the ability to live and thrive somewhat, however that looks for you, because that's different for
Yeah.
everybody, while you're in those waiting periods. You're so right that like even for me, I'm like, if you could just say, here's a pill and it'll fix you, I might hesitate, but I also might not, right? Like
That's
it's
the
like
thing.
if you can promise me that this is going to be there, I really might take it. But at the same time, if this other thing to do could fix me too, and it could fix me a little bit slower, maybe not fix me, it might be the wrong word, help me, but help me a little bit slower, but it'll help me in stages, but it might also really help me in a way that I didn't expect. There's other things that you get out of it, a connection with yourself to where the next time you're in, this really stressful situation or your symptoms are starting to come back and you're like, what do I do? I really don't feel well. Well, if you've taken that one pill and these things are coming back, you never learned what to do around those symptoms. And that's where so much of this comes in that I feel is so often overlooked because that's the supportive arm that can be so helpful and make such a
The
difference.
the good news is though, um, like as opposed to traditional therapy, um, this is pretty short term. So we're talking, usually between 8 to 12 sessions, often maybe 3 to 4 months. And at the end of that time, first thing you're going to know ahead of that, is this even going to help me? Right? Even
Yeah.
probably like 5 sessions in, get a sense if this could help or not.
Yeah.
But even at the end of that, you're going to have, like you said, skills that you can use the rest of your life. And that's
Yeah.
why when you look at the research, these patients, when they get better, they stay better
Hmm.
versus if you take a drug, even if it helps, awesome. This is awesome. But
Yeah.
then you stop taking that drug, what's going to happen?
Yeah. And this is that thing where I feel there's a time and a place for both. But again, what feels to me, and it sounds like with so many conversations, whether it's with experts like yourself or other patients or just other people, that you need to marry both sides, right? Like that's how you have that healthy relationship. That's how you can have the better outcomes or set yourself up for the better outcomes because you're not just looking, with blinders on down one hallway. You're looking at everything and really trying to give people tools to feel better. Cause like you said, like if tomorrow, I take Motegrity, right? It's a great medication. It's very much been a game-changing medication for me. Now, if I just randomly have to stop taking it tomorrow, what am I going to do? What skill, like over the years, I may have learned a couple skills that have been helpful or, might kind of be a band aid. But what skills do I actually have that could help with like those constipation issues? What things have I learned? Not all that much in all reality. That doesn't require some sort of other medication or some sort of other issue, and that's where I look at this and I think about every conversation I've had with a GI doctor in the over like a decade since I've been sick, where I'm like, this is the kind of thing that I could have really benefited from all those years ago. Maybe I wouldn't have needed the medication, or maybe I would have only stayed on the low dose of the medication. Who
Right.
knows what could have happened, but it couldn't have harmed me by giving me more support. And that's where I'm frustrated, as I know you've been too.
And that's it. We're not against medication. We're not some like again,
No.
it's not about either or. It's about complexity and about like, okay, how much medication do you need? Can you take the lower dose? Can you get off that medication and then take a less strong you know, um, and I think when it comes to patients, when it really comes down to it, what most patients want deep down is a sense of control
You
because
are
they
not wrong.
feel out of control.
Yeah.
And if you can give them a tool, let's say they're at an 8 for pain
Mhm.
or discomfort or something, if you can give them a tool that even lowers that pain or discomfort by 1 point, that doesn't seem like much, right? You're like, "Ah, that's 1 point, who gives a crap?" But people give a crap because
Yeah,
that is something they can control.
absolutely.
So even if it's 1 point of that, the benefits for them psychologically to have that control are massive, are
Yeah.
massive.
Yeah, I could not agree more. And you look at it where, yeah, it's only 1 point, but it's 1 point lower than you were before. And it
Right.
gave you a tool and it lessened something. It's not a lot, but it's something. And that something is the thing that we've been missing. Like you said it so clearly in the beginning. When you start looking, you're like, where is this directed research? Like, what is happening to this poor community of people? We have
Yeah.
been screaming this for years. We've been screaming. We have patients in our support groups and in our like Facebook groups and everything where we
Yeah.
see the suffering that's happening. We see the disconnect. We see the inability to get to physicians because in a lot of ways, there's not enough of you guys either, that there are too many of us. You guys are burned out. We're burned out. There's disconnect of information. And we're all just sitting here like, we just want to feel better. Like, we just want to eat and not feel like we're going to explode after that. And when I've talked to, able-bodied people or, people who are advocates that maybe don't understand something, I'm like, imagine if I told you you just can't have breakfast. Like you prepare your whole breakfast and you go to sit down and I just take it away from you and be like, sorry, you don't get that
Push it
anymore.
off the table.
Or,
Yeah.
you get to eat a bite of that and then I'm going to punch you in the stomach.
Yeah.
See, like, does any of that feel good? I didn't think so. So please help us because that's what we deal with day in and day out all the time of, will this hurt me? Can I eat this today? And then you get down to, is someone going to believe me? So there's so many nuances and so many different working parts to this diagnosis and to living with it every single day that there's a lot of us that are unable to thrive. Like we are bare minimum surviving. I've been there. I've been lucky enough that I've come out of that time in my life. But, I sit here in front of you looking pretty healthy. I'm coherent. I'm up. I'm doing something, but it doesn't account for the before and the after. And it's not so easily seen. And if you don't understand the disease, like most invisible illnesses or chronic conditions, that they're so dynamic and complex that if you're not understanding that just in the beginning, that like it's not easily understood, it's not easily treatable.
So I'll tell you a patient story. So a guy named Alex, he's got functional dyspepsia. If you're familiar with that, it's kind of like an upper GI thing, and had and I'm not even sure about what his gastric emptying test was saying or not saying. So he might have also had gastroparesis as well, because he had tremendous amount of discomfort, bloating, and like very, very little appetite. right? So he was losing weight. He had he had, like, had to quit his job. He had had to drop out of school. He was
Yeah.
living on his parents' couch, watching Netflix, depressed and suicidal,
Yeah.
right? But luckily for Alex, he over time built a team, right? And so it was so he had like a functional medicine doctor. The functional medicine doctor knew about me,
Mhm.
referred Alex to me. I referred Alex to Dr. Drossman, if you know who that is, with the Rome Foundation. Um, so he had this team, and so Drossman is messing with his meds. The functional medicine guy is doing his thing, and it turned out Alex was also responded really well to hypnosis.
Wow.
And I can remember one session with him. He's pretty miserable, he's got a lot of bloating. And we do this one hypnotic technique called the control room. And it's a very simple technique. You kind of go into trance, and then there's a control room, and you can choose what symptom you want to control. So we picked the bloating. And I always remember Alex's reaction because he was able in that control room to turn down the bloating.
Wow.
Physiologically, we can have a discussion about what was happening or not happening while that was happening. But
Mhm.
for Alex, what he perceived is like there was bubbling and moving and shifting. And then as we turned it down, he was like, holy shit, I feel hungry. Like, I feel hungry.
Yeah. That's
And by the end of it,
amazing.
he was like, wow, like I haven't felt hungry in days, you know?
Wow. Yeah.
And if he had never gotten this kind of treatment, he would have never known that he had that capacity to just shift his symptoms in that way. He would have gone his whole life never knowing that. And that would have been very, very sad.
That makes me so emotional. Like for two reasons. One, like happy emotional that somebody, that type of therapy helps somebody. But it also reminds me of a like functional medicine doctor that I had been seeing on and off for like the last decade plus. And one of the times where, and it wasn't hypnosis, but very similar idea where he was doing a lot of work on me. We were doing mental work, a little bit of
Yeah.
like physical work on my stomach and massage in a certain way. And when I finished the appointment, he was like, "Okay, before you go home, go to the store, go get yourself some spinach and go cook it and get like a rotisserie chicken or something, peel all the skin off, don't eat any of the fatty stuff and just go home and just eat what you can of that." And I'm like, "Yeah, okay, bro, like all right, sure." But I trust it. I'm like, "I trust you. I'll go do it." Guess what I did when I went home? I ate the spinach and I ate the damn chicken. And you know what? It worked. And frankly, I was like, I don't care if that's a placebo effect. I don't care what the hell it was. It worked. And that's the thing that, again, you're like our providers, our motility specialists, our GI guys, like they are good at what they do. This is not what they do, but this is another piece of the puzzle that can be so beneficial. Not everybody's going to leave an appointment and go home and be able to eat, chicken and some spinach. And, it might not be like that every time, but talking about the control, that's something that like I struggle with because I like control, right? Like I want control of my own body. I
Right.
want to
Who
control of all of those things.
who
So,
doesn't want control? Name one
but
person who doesn't want control of their
I
body. I mean, that's like fundamental.
Yeah, and the more it's out of control, the more that you don't know what's gonna happen, and, like, you're filling out, like, paperwork, and people are always like, "What are your bowel movements like? What do you feel day to day?" I'm like, "I don't know, it's unpredictable. I have no clue what I'm gonna wake up to every single morning. I don't know if my breakfast is gonna stay down. I took a lot of Zofran before we hit record just to make sure that it stayed down while we were doing this," you
You
know?
wanted control. You wanted control.
Exactly, so you're in these situations and it's like, but if you can give somebody back something, again, you're not claiming to cure whatever it is that's their bloating. It's not
It's a
that. It's
piece.
a
It's a
piece.
piece.
Yes.
Yeah.
Yeah.
And for some people, it's gonna work better than others, and for some situations, it's gonna work better than others, and for some but, like, we all wanna have options,
Yeah.
right?
Yeah.
And it's awesome that we live in a country that has, the ability to create drugs and keep them at a high quality so they don't poison us and
Yeah.
like this is a beautiful thing. And it's
Yeah.
an option, but we also need other options. And if we can understand the way our bodies work and the way our brains and our guts communicate, that's just
Yeah.
another option, you know?
Yeah.
Uh, there's a
I love
story I
it.
was thinking of telling. I've never told this story before. Um, okay, yeah, let me just go for it. This is a story about me, right?
Mm.
Because I've learned these skills myself. Like I don't just
Mhm.
teach it to other people; I learn it for myself. So anyway, I'm doing a training, and I'm training new clinicians in hypnosis. And I made a little mistake. It was at the hotel and they're offering food, and I had the Caesar salad with chicken.
Mm.
As I'm eating it, I'm thinking to myself, like my wife telling me, yeah, it's the salads that'll usually get you in terms of like food poisoning. And I'm
No.
like, yeah, but I want something light. So I eat my salad.
Mhm.
Halfway through my training, I feel a little something. And I'm like, okay, let's see what happens here. And by the end of the train, like I'm gritting my teeth, it's coming in waves. I'm like,
Mhm.
I need to go somewhere and deal with this urgently. So like I'm talking to the guy, I'm like, look, I'm sorry that, I really have to go deal with something.
Mhm.
Um, so the training's over. I go in there and I deal with it. And I know that it's gonna come in waves because I've eaten bad stuff before, and so I just went through the first wave, and I'm like, "I got 20 minutes to get home. I need to get home." So I get in the car, I run, the garage, I get out there, and I'm like, "Okay." And then I feel it again, and I'm like, "Oh, man, I don't know if I'm gonna make it." So I just stop. I'm like, "Okay, this is what you do." So I just
Mhm.
stop. I go into self-hypnosis. I take all those feelings and I just toss them in like this mental box, this like
Mhm.
mental vault. I close the door and I'm like, I don't know if this worked or is gonna work or not, but let's see.
Mhm.
And then I drive home and I'm like, oh, maybe it was just one wave. Maybe it wasn't a big deal. And I get home, I walk in and I go to start telling my wife like what happened. And immediately I feel it.
No.
So as far as I can tell, what happened was my brain and my unconscious mind were like,
Mhm.
I basically was like made a deal with them. I said, keep
Get me
this
home.
under wraps. Yeah, get me home and then we could do whatever we need to do.
Mhm. That's
And
so funny.
literally I walked in the door and then bam, I felt it. I was like,
Mhm.
wow, that that is like what my patients experience.
I was gonna say the story of every patient.
Yes. I was like, that is the mind gut connection right there. Right there.
Mhm. Yeah,
Yeah.
it's so interesting because I can't tell you how many situations like that I've been in. When you go someplace or you're traveling, we're like, okay, how far is the next rest stop? Where's the next bathroom? How quickly can I get out of here? How many medications do I need on me and all that stuff. So if I don't have to stop and take something and I can just sit down and find maybe not a quiet place outside, but a quiet place internally and just settle something down, even temporarily, that's a huge, huge win in my book. And I would, love to be able to do that for myself. And I know actually I don't know any patient that wouldn't want to be able to do that for themselves. So that's definitely something, to really I think now that you're talking about that, I feel like I might do that for myself to a degree,
I
but
believe
to
it.
think of
I believe
to
it.
think about the little bit that I can do, what powers could I develop, if we start
I
doing
that's
this?
that's hilarious. Like, I totally think of it like that. I feel like we all have superpowers,
Mhm,
and it's like one of those superpower movies where the superhero is, like, just developing their power,
mhm,
and they need to meet, like, the old wise person that, like, knows how the powers work to, like, train them, and then they can, like, fully use their powers, like, for the rest of the movie, right?
Yeah, we all love superheroes, so, and being able to do that, it's like, with that great power comes great responsibility, and it's like, these are
Yeah,
the things that we need. These are, like, all of the pieces of the puzzle that I can see so many of us have been missing. And, even just having that feeling of somebody believing in you and believing that you can do this and that, like, this isn't the life meant for you, right? Like, there's so much more available. There is, the way that you may have envisioned yourself thriving, you might not get that, but we can get you something because we can teach you this really cool thing. And to
and
come into your power, that's a big one.
yeah, and the extra bonus is that person working with you has seen hundreds of other people in similar situations
Yes.
go from hopeless to like some level of improvement, to have
Yeah.
their lives being transformed. And so they have the experience of having helped many people develop their powers, right?
Yeah. Yeah.
You know,
So I'm
because
gonna
you
look
have
at this
them.
from
I
now on.
guarantee you, you use some powers in your
Mhm.
day-to-day life. You use some mind-body
Mhm.
approaches that you've just kind of had to, out of
Yeah.
necessity, come up with on your own.
Yeah, and when you really look at it that way, and to think that to some degree, just to get through the flare, the symptom, the life, whatever it is, that we're already doing this, it's like, why does it seem so far-fetched sometimes? Like the way that it's been presented for so long of like this thing. It's like, but we're already doing it.
Yeah.
And you don't even realize it. I didn't even really put that together until we were talking today. And we've had many
Wow.
conversations and I've never put
Yeah,
that together, So I'm
yeah.
like, all right, what a cool thing do I already know how to do and how can I hone
Well,
my powers?
it's like we're already doing it for good and for bad, and we don't
Mhm.
even know it. Because
Yeah.
how many times have you
Yeah.
been kind of, like, doing okay, and then a thought just comes into your head like, "I wonder if I'm gonna have X problem,"
Oh yeah.
and then you're like, "Oh, shit."
Mhm. Yep.
And then it starts kinda happening.
Yeah.
We This is a two we do it for good and we do it for ill, and
Mhm.
until we've learned how to control our powers, we're kinda like Superman flying into buildings and, you know
Causing chaos everywhere we go.
Yeah, he
Yeah.
does some good, but he also maybe destroys some buildings on the way
Yeah.
because he just doesn't quite know how to fly yet.
Yeah.
Um,
Yeah. No, you're not wrong. And, I've learned myself that it's the same thing. Like, you can talk yourself into anything and you can talk yourself out of anything, right? Like, our brains, our minds have so much freaking power. And I've learned that the moment I start questioning something, I'm like, nope, nope, we're not, nope, absolutely not. I'm too anxious of a human. I cannot do that. So I just
right.
have to run with it and just hope and pray that it will turn out okay. And that's not always the best way to do things, but it keeps me from having those, like, talk myself out of something moments or, in a situation where I'm like, I'm really worried that I'm not, I know that I haven't been feeling well, like, and I'm really worried about maybe traveling because I haven't been feeling well. And then it's like you can make yourself feel worse because of that worry, because of that internal, dialogue that you're having with yourself. So, if there are tools out there, which we know there are, to help flip that dialogue in your head, you're not saying like, I just don't feel good anymore. You're not invalidating yourself. You're actually validating the heck out of yourself in the parts of your brain that we're not even touching right now. The parts of your mind of that, I can do this. I have this power. I have this ability to really help myself here. Why not lean into it? Right.
Yeah.
And it just
Learning
sounds so funny when you think about it. But at the same time, I'm like, no, it's not. It's awesome. You're freaking powerful. Like, lean into that.
it's like learning to trust yourself
Hmm.
more. I remember I worked with this young lady who, was pooping about 7 times a day with
Oh,
very little warning, so, like, really intense urgency. So, she had been trapped in her house for at least like 3 or 4 months when I saw her. And this is like such a weird thing to say, but like I was so happy for her when she could finally get on an airplane
Yeah.
and go on
Yeah.
a trip.
Heck yeah.
You
That's
know what I mean?
amazing.
And get down to like 2 poops a day, right?
Yeah.
Like
No, that's
that was awesome.
amazing. Yeah.
Yeah.
And those are the things that I think are often like, again, get overlooked in treating patients and treating people with these diseases is that we're not asking, I mean, we'd love to ask you for a cure, right? Like we'd love to ask you just to like fix us, right? But if we can't do that, that going from being housebound to freaking getting on a plane, that is huge and so like off or often overlooked because like the ability to go function like in the wild, to be able to participate as a relatively normal human being in the world with not no fear, but less fear and the confidence that even if you come into a situation, you have every tool at your disposal right now to handle what is coming at you. And if you can't handle it, you've developed a plan B and a plan C, and you've got other support systems to come in because you've built this entire system for yourself to help get you out into the world. Because every one of us who've dealt with some sort of GI issue, to not being able to leave your house because you're so afraid you're going to poop yourself no matter what you do, you're terrified, to vomiting, to pain, to just fatigue, weakness, all of those things is so isolating. So just the fact that she went from being isolated to now no longer being isolated 24/7, what that
Dude,
does to someone's mental state is just, it's almost better than anything else because it gives you that confidence, it gives you a life again, and that's really all we ever asked for. That's all we want, besides the cures that I know are too hard to ask for. But we really just want to feel better, we want to feel more normal, we want to feel like we're worth something and that we matter. And if these types of things can get us there, like why the heck not?
and sometimes a cure looks different. You know what I mean?
Yeah.
Like maybe almost the theme of our talk today has been like simplicity versus complexity,
Yeah.
right? And so maybe a cure isn't a thing. Maybe sometimes the cure is like 100 different things put
Yeah.
together slowly over time.
Yeah.
And you don't even know the point when you were cured. It
Mhm.
was just so subtle. It was
Mhm.
such a little piece, like you're putting together this huge jigsaw puzzle.
Yeah, no, that was beautiful. That was very beautiful because I really, I think that's, it's so true. It really is. And I just love that thought process because it just shows that, I hate to say it, but anything worth having, comes with some work. It's like it's not easy and we all know that, but to get there, it requires a multi-system, support where you get it from everywhere, but it really does start with us too as patients being open-minded and to really believe that there is something out there for us. There's, and I know probably not every patient will agree with that statement, and I get that. We're all in different points in our journeys and our lives and our diseases, and it just, I think of my younger self where I was, where I'm like, would I ever have gotten as bad as I did if there had been an earlier intervention, and it's
Right.
like, would I still have ended up in that place? Maybe, possibly, probably, who the heck knows? But if we can stop that isolation from happening, if we can stop
Yeah.
it getting to that point and giving people the help before then, like that's a huge thing. And I love these conversations. I learn a ton from every conversation I've had, whether it's with a clinician or a patient or just somebody else in the nonprofit space. Like I learned so much from everybody. And I can't thank you enough for this conversation and really diving into what this looks like and what it can do, because I think that it's just going to help more people. And we keep having these conversations no matter how difficult, how vulnerable, because that's where change happens, is in the uncomfortable places. And, nothing ever changed if we didn't step out of that comfort zone. And I sound like a book of cliches right now, but they're true. They're very true cliches.
Well, Sam, I really appreciate you having me on, and it was such a pleasure talking with you and just kind of like just going wherever the conversation took us, and I think it took us to some good places. So
Yeah,
I really
absolutely.
appreciate you taking the time, and
Yeah.
hopefully this will help somebody out there, even if it's just one person.
Yeah.
I'm happy.
Yeah, and I'll make sure, to put all, your information, how to get in touch with a clinician, to talk to somebody, do, like, your consult call, put all of that, like, in our show notes and everything for anybody that's interested. So thank you again so much. It's been great.
Yeah, my pleasure.